Healthcare Cancer Institute. And joining us today to talk about what they're discovering there is medical oncologist Dr. Sara Dost with St. Vincent Medical Center. Doctor, thank you for being here. Appreciate it.
Thank you so much for having me.
All right, first, tell us what the researchers are looking into here.
So this is a trial focused on HER2-positive breast cancer, and in certain situations, we do chemotherapy before patients go off to surgery. This specific trial is looking to see if we can use less chemotherapy drugs for a shorter duration and still achieve comparable outcomes, compared to doing standard of care treatment that we currently have with chemo.
Who's the perfect candidate for this trial?
So the folks that we recommend for this trial, or those who are eligible for the trial, are those who have HER2-positive breast cancer. It can be hormone receptor positive or hormone receptor negative. And we say if they're a clinical stage 2. So what that means is, if their tumor size is 2 centimeters or greater, or if the cancer is involving the lymph nodes in the underarm.
All right. So you do have some patients in this study, right? And tell us how they're doing so far. What's happening?
Yeah, so I do have a number of patients that we've been able to kind of get through chemotherapy. A few of them have made it all the way to surgery. My patients are thrilled that, they only have to go through 4 cycles of chemotherapy compared to 6. So they've done well, and, we're waiting for official results from the study to get all of that, official data.
When you offer a clinical trial like this, do most patients say yes, or is there hesitancy? What happens?
So it's a mixed bag. Deciding to do a clinical trial, it's a very personal decision, and there's a lot of factors that go into play. Some of my patients are just thrilled at the option of doing chemotherapy for, a shorter duration of time with less drugs, because that really translates into less side effects. I have other patients, however, who they want to do what's try to and what we have the data behind, so they don't feel comfortable, deviating from standard of care.
Right. So what's the benefit of taking part in a clinical trial? What's the benefit to your patients?
So, you get the best care for your cancer. The nice thing with clinical trials is that you may be getting a drug or an approach that you wouldn't normally be getting. So it's a great way to do that, and it's a wonderful way to contribute to medical research as well. You're helping other patients with similar cancers, and you're helping us make advancements for the future.
All right. Well, I know you have more information at hartfordhealthcare.org/cancer. We'll link you there from WTNH.com. Dr. Sara Dost, medical oncologist at St. Vincent Medical Center. We appreciate your time. Have a great day.
Take care.